There you go.
This is Orsi, old guy from www.oldguytalks.com here at Serrano and Krieger Orthodontics. And I'm getting my sleep apnea device delivered today by Dr. Paul Serrano. I've known Paul for, well, over 30 years. Actually, when we first met, we were both young, but that's not the case.
That was in days gone by.
That was
a few kids ago.
That was a few kids ago. And so, Paul, tell us a little bit, sleep apnea, like snoring. Sometimes people think just snoring is just snoring and you wake up your person that you're sleeping with, or you wake up yourself. But there's lots of problems with people snoring.
Well, probably sleep apnea is becoming now a lot more frequently diagnosed because of what we call comorbidities, the other things that go bad when you don't get oxygen throughout the evening. When you get interrupted sleep, that causes the oxygenation to go down, etc. So, a lot of physicians are noticing that certain comorbidities like high blood pressure, obesity, diabetes, and stuff are all highly correlated. Mm-hmm. Dentistry-wise, we notice that teeth start to wear down faster because of during that cessation when you're waking up, you abrupt more. You get a shot of cortisol, you get a shot of adrenaline. So we notice, the teeth are wearing down faster. What patients notice is, I feel like I'm getting old too quick. I'm always a little bit groggy in the morning. I know you don't drink wine, Oris, but
no, never.
Sometimes they'll
not this morning.
they'll describe it as, I'm just a little dull those first few hours. Well, that's that lack of sleep with normal sleep cycles. So when I do my best work and the patient wears their appliance, they will wake up and say, I feel pretty awake when I wake up now. I don't feel groggy. So that's the patient's noticing that need for 6 to 8 hours of sleep is more important than
Yeah.
Some people used to think, well, when you get old, you don't need as much sleep. The reality is you need more sleep when you get old because you've still got the same rejuvenation, the same mental capacities and stuff to do. So, several years ago, we kind of got into this thing of saying, how do we take adults and make them sleep better? We were doing it with kids forever, adenoids, tonsils, expanders, and then when we kind of learned that this was an alternative to using a CPAP mask, it was like a match made in heaven because that's what we do.
So let's. I want to talk about that's exactly things I was just going to head that. So let's take a look at this thing here, folks. I want to take a look because we just talked on touch base. That the mask that you wear. It kind of looks like you got that whole thing, and I'll guarantee you that's definitely is. Well, it may be a relationship killer. Definitely, you're not going to have
statistically, if the compliance with the CPAP and the mask, the compliance with that is probably less than 60%.
Yeah. So, folks, this is just a really small little thing that fits comfortably in your mouth, and Paul's here going to fit that for me here in just a little bit. I'm going to sign off here in a little bit, but it's just a very simple, small thing. Comfortable to wear. I know that for a fact because my wife told me, because she's got one, and she told me that it's comfortable, and she wears it, and she said, honey, you're snoring. You need to get this done also. So I'm here getting this done, and I'm looking forward to having some nice sleep because I'll tell you, I have not been sleeping. I've never slept well. I wake up all the time in the middle of the night several times for a number of reasons, and so I'm looking forward to getting a good night's sleep and waking up rested.
Yes, and this is almost as good as marriage counseling.
All right, yes. So this is Orsi, old guy from www.oldguytalks.com. If you have not already opted in, what are you waiting for? When you opt in, you're get my 3 ways how to get laid more frequently without begging. That's right. You don't have to give up your man card. You don't have to suffer the indignity of begging. It's going to be it. Take care. It's all it.